Hey guys, so this is rhythm B, and first and foremost, it's called sinus bradycardia. So, what are we looking for again? It's rate, rhythm, and quality. So, first of all, rate. This rate comes out to be about 35 beats per minute, and the way to determine that, again, is using a little square counting technique. So, remember, the small little lines are about 0.04 seconds, and the bigger thick lines, which represent five of those little boxes, they represent 1/5 of a second or zero point 0.2 seconds. So by counting them up, you're going to find that there's a beat about every 1.7 seconds, which means it's about 35 beats per minute. That seems a little slow, just intuitively, and it is. So what's going on here? When we look at the P wave and the QRS complex and the T wave, they're all upright, which is good. That indicates to us that the signal is indeed initiated by the SA node, the sinoatrial node, up at the top of the heart. So then the pacemaker is actually being slowed down. So the signal is conducted properly once it's being initiated, but just takes a while, and there's this immense delay, as you see in this rhythm. It's taking a while in between beats. Where's the rhythm? There it is. It's taking a while in between beats. This means that the SA node is just being suppressed. In other words, there's nothing necessarily wrong with the conduction system as soon as the SA node actually sends the impulse. So if the pacemaker is being slowed down, what are the causes of this? There's a few of them, and they're not all necessarily bad. Like I said, this is generally a bad thing, but in some people it could actually be a normal rhythm. I'll get to that in a minute. So the most common causes of something like this, sinus bradycardia would be increased vagal stimulation, which we actually already learned about, but under a different name. So this would be the vagus nerve innervates the parasympathetic nervous system. So if you have a vagal stimulation, you're stimulating the parasympathetic nervous system, which, as you know, causes the heart to slow down. So vagal stimulation is causing indirectly through the parasympathetic nervous system the heart to slow down, the pacemaker to slow down. Alternatively, this could be drug induced. So just intuitively, you can imagine if you're taking drugs that slow your heart down, this might be one of their mechanisms of action. A third possible cause could be hypothermia. Patients who are hypothermic, their heart's going to slow down, and it could look something like this. And lastly, as I mentioned, it's not necessarily a bad thing. This could actually be a normal resting rhythm for someone. The classic example would be a cyclist or an extreme endurance athlete. So if you go up to Lance Armstrong, this could actually be what his EKG looks like normally. For someone like you or me, this would be potentially very dangerous because we wouldn't be getting enough blood, but a very trained athlete could actually be getting perfectly fine blood based on these rather spaced out contractions. So again, 4 causes: increased vagal stimulation, in other words, parasympathetic stimulation, a drug-induced state, hypothermia, or it could just be normal.